Do medications for diabetes and weight loss make you urinate more? If you've started a GLP-1 medication and noticed you're running to the bathroom more often, you're probably wondering what's going on. Let's talk about the connection between these medications and urination and what you should know. Here's the thing. Frequent urination isn't actually listed as a direct side effect of GLP-1 medications in FDA prescribing information. These medicines aren't diuretics and aren't known to directly increase urine output the way some other medications do. But some people do notice changes in their urinary patterns, and there are a few reasons why that might happen. First, let's quickly cover how these medications actually work. GLP-1 receptor agonists like semaglutide mimic hormones your intestines naturally release after eating. Tirzepatide works similarly, but is actually a dual GIP/GLP-1 agonist. They help your pancreas release insulin when your blood sugar is high. They slow down how quickly your stomach empties, and they work on your brain to reduce appetite. None of these mechanisms directly cause increased urination. So why might you be peeing more? There are a few indirect factors at play. One is weight loss. When you lose weight, especially in the early stages, your body releases stored fluids. This is a temporary shift that can mean more trips to the bathroom. It's not the medication itself, it's your body adjusting to the changes happening. Another factor is improved blood sugar control. If you have type 2 diabetes and your blood sugar was running high before starting treatment, you might have been experiencing more urination because of that. High blood sugar causes your kidneys to work overtime trying to filter out the excess glucose, which pulls water along with it. As your blood sugar improves on the medication, this should actually get better, not worse. Hydration changes matter too. Some people drink more water when they start these medications, especially if they're being more mindful about their health overall. Or you might be drinking more because of nausea, which is a common side effect. More water in means more water out. Dietary changes can also play a role. As your appetite changes and you eat differently, the types and amounts of fluids you're consuming might shift too. Now, what should you talk to your doctor about? If you're noticing urinary changes, it's worth mentioning at your next appointment. Your healthcare provider can help determine whether what you're experiencing is normal or if something else might be going on. They might want to check your blood sugar levels to make sure they're in a healthy range. They can also assess your hydration status and make sure the gastrointestinal side effects some people experience aren't affecting your fluid balance. It's also important to know when to reach out to your doctor right away. Contact your healthcare provider if you're experiencing excessive thirst along with frequent urination. This combination could signal that your blood sugar isn't well controlled. Reach out if urination becomes painful or if you see blood in your urine. These could be signs of a urinary tract infection or another issue that needs attention, and watch for signs of dehydration. Dark urine, dizziness, or feeling lightheaded are all reasons to call your doctor. Severe nausea, vomiting, or diarrhea can cause dehydration and, in rare cases, affect kidney function, so it's especially important to stay on top of this while taking these medications. Speaking of hydration, let's talk about managing it while you're on these medications. Staying adequately hydrated is important. The gastrointestinal side effects that some people experience can affect your fluid balance. Make sure you're drinking enough throughout the day, but also pay attention to your body. If you're drinking a normal amount and suddenly peeing much more, that's information your doctor needs to know. So let's recap. GLP-1 medications don't directly cause frequent urination as a pharmacological effect. If you're experiencing urinary changes, it's likely due to indirect factors like weight loss, improved blood sugar control, or changes in how much you're drinking. And always contact your healthcare provider if you have concerns about urinary symptoms, especially if they're accompanied by other symptoms like excessive thirst, pain, or signs of dehydration. Remember, this information is educational and not a substitute for personalized medical advice. Always consult with your healthcare professional about any symptoms or concerns you're experiencing. Have you noticed any changes since starting a GLP-1 medication? Drop a comment below. And if you found this helpful, hit that like button and subscribe for more evidence-based health information.